On the night of February 19th, 1994, the ER at Riverside General Hospital was about to face something it had never seen before. A 31-year-old woman named Gloria Ramirez arrived with what looked like a standard medical emergency: chest pain, rapid breathing, confusion. But within minutes of her arrival, hospital staff began collapsing. One by one, nurses, doctors, and technicians fell ill. 23 people were affected, 5 were hospitalized, and by the end of the night, Gloria was dead. The cause? Still not fully clear. What could make a woman so toxic that she took down an entire emergency room? To understand the mystery, we have to look at what happened just before she arrived. Prior to arriving at the emergency room, Gloria Ramirez's boyfriend, Johnny Estrada, called 911, reporting that Gloria had been suffering from nausea and vomiting throughout the day. At around 8:15 p.m., Gloria, now experiencing severe heart palpitations, was rushed into the emergency room at Riverside General Hospital by paramedics. Upon arrival, she was extremely confused, and doctors noted that she was suffering from tachycardia, an abnormally fast heart rate, and Cheney-Stokes respiration, a type of abnormal breathing pattern. Cheney-Stokes respiration, or CSR, while more commonly associated with heart failure in adults, is rare in younger individuals. It involves a cyclical pattern of breathing with periods of apnea, which is a cessation of breathing followed by hyperventilation. In young adults, CSR can be indicative of serious underlying issues, particularly heart or lung conditions, making Gloria's condition even more unusual for someone her age. Maureen Welch, the respiratory therapist, pointed out that despite Gloria's cervical cancer, her age made this condition atypical, as such respiratory issues are more common in older patients with severe heart failure or lung disease. As Gloria's condition worsened, the medical team administered diazepam and lorazepam and followed up with lidocaine and beryllium agents to address her abnormal heart rate. But despite these efforts, Gloria began to go into shock. When it became clear that the treatments weren't working, the staff attempted to defibrillate her heart. That's when something disturbing caught the attention of several medical workers. Gloria's body was covered in a glossy, oily sheen. Some also noticed a fruity, garlic-like odor coming from her mouth, which seemed completely out of place. Registered nurse Susan Kane drew blood from Gloria's arm, only to detect an overwhelming ammonia-like smell coming from the syringe. As she passed the tube to Julie Gorchinsky, a medical resident, Julie noticed something even more bizarre: manila-colored crystals floating in the blood. Almost immediately, Kane began feeling a burning sensation on her face and fainted. Julie, now feeling nauseous and lightheaded, left the room and collapsed shortly after. The third to go down was Maureen Welch, the respiratory therapist, who reported that the blood smelled less like that of a cancer patient and more like the ammonia odor everyone had been describing. When she regained consciousness, she found she couldn't control the movement of her limbs. At this point, the situation was deemed an emergency, and staff were ordered to evacuate the entire emergency room, moving all patients into the parking lot as the hospital went into lockdown. As the emergency room staff began to regain their bearings, the situation was far from over. During this time, a skeleton crew stayed behind to stabilize Gloria Ramirez. Despite their best efforts, after 45 minutes of CPR and defibrillation, at 8:50 p.m., Gloria was pronounced dead from kidney failure, a complication related to her cancer. The staff's initial suspicion was that there had been a toxic gas leak or some kind of chemical spill, but a thorough investigation of the emergency wing revealed no signs of contamination. Hazmat teams from the Riverside County Fire Department were dispatched and scoured the entire facility. Tests came back negative for any biological or chemical agents. Meanwhile, Gloria's body was moved to a separate room next to the trauma room, then later bagged and placed into an airtight container for further investigation. As the hospital continued to search for answers, it became clear that 23 people who had been in Gloria's vicinity had become ill. with 5 hospitalized. The cause of the sickness remained unclear, and it was uncertain what exactly had led to the widespread symptoms of nausea, dizziness, and a burning sensation felt by those in the emergency room. The investigation into Gloria Ramirez's death raised more questions than answers. Despite a hazmat team inspecting the hospital, no chemical, biological, or gas leak was found. Gloria's body was placed into quarantine, and a full autopsy was conducted. The initial findings were surprising. Gloria's cause of death was attributed to heart failure due to kidney failure, likely caused by the late-stage cancer and her medications. However, this didn't explain why so many others had fallen ill. The Riverside County Health Specialist Department called in California's Department of Health and Human Services, which assigned doctors Ana Maria Osorio and Kirsten Waller to investigate. They interviewed 34 hospital staff who had been working in the emergency room on February 19th. Using a standardized questionnaire, they discovered some unusual patterns. People who had developed severe symptoms, such as loss of consciousness, shortness of breath, and muscle spasms, tended to share certain characteristics. Specifically, those who worked within 2 feet of Ramirez and had handled her intravenous lines were at the highest risk. Yet, other factors did not align with the scenario involving fumes. The survey found that the individuals affected were primarily women, and all had normal blood tests after the exposure. Despite these findings, the department concluded that the symptoms were likely the result of mass hysteria. In total, 27 of the 37 staff members in the emergency room that night reported experiencing some form of symptoms. After further testing and a second autopsy, a surprising discovery was made. Dimethylsulfone, DMSO2, was found in Gloria's body, a substance that could explain some of the strange symptoms, like the garlic smell and the oily residue. DMSO, a chemical often used in alternative medicine as a pain reliever, was believed to have been converted into DMSO2 in Gloria's system. DMSO, dimethyl sulfoxide, is a powerful solvent that has been used in topical creams for pain relief and inflammation, particularly in the 1960s and 70s. It is also used in veterinary medicine, mainly for its anti-inflammatory properties. However, DMSO can be absorbed through the skin, and when exposed to high concentrations of oxygen, it can convert into DMSO2, which is typically harmless in small amounts. But in Gloria's case, the higher concentrations found in her body seemed to cause an unexpected reaction, potentially explaining why both Gloria and the medical staff were affected so severely. As the investigation deepened, a crucial breakthrough came when scientists began looking into the chemical properties of DMSO2 and its potential link to the strange events at the hospital. Researchers, including Pat Grant, a scientist studying the case, discovered a connection between DMSO2 and dimethyl sulfate, DMSO4, a nerve agent once tested for use in chemical warfare. Dimethyl sulfate is an extremely toxic substance, dangerous even in small quantities. Historically, it was used in the early 20th century for military purposes and later as a chemical warfare agent. When DMSO is exposed to concentrated oxygen, such as through high levels of oxygen in the hospital room, it can convert into DMSO2, which under certain conditions can transform into dimethyl sulfate, a highly toxic compound. The theory proposed was chilling. During Gloria's treatment in the hospital, the oxygen mask she was given could have triggered the conversion. But the final piece of the puzzle came when scientists suggested that the defibrillator shock might have provided the energy necessary to convert DMSO into dimethyl sulfate, a nerve agent. In essence, Gloria had unknowingly turned her body into a toxic gas factory, releasing a nerve agent into the emergency room when the defibrillator was used. What followed was a string of unbelievable coincidences that, when pieced together, provided a possible, if unsettling, explanation. Gloria, struggling with late-stage cervical cancer, may have been trying to manage her symptoms using DMSO, an alternative treatment sometimes used for pain relief. DMSO, when absorbed through the skin, can convert into DMSO2 when exposed to oxygen, as it likely was during her transport to the hospital. The defibrillator shock, which was intended to save her life, may have provided the necessary energy to trigger the transformation of DMSO2 into DMSO4. As absurd as it sounds, this series of events, the oxygen mask, the DMSO, and the defibrillator shock, seemingly turned Gloria into an unwitting weapon, releasing a nerve agent into the room. It wasn't intentional, but the chain of circumstances that led to this situation was so strange that it was difficult to ignore. Tragically, this incident highlighted the unpredictable dangers of combining alternative treatments with standard medical procedures and the devastating consequences of an accidental chemical reaction. Gloria's family denies she used DMSO, and some continue to believe there's a larger conspiracy at play. But no matter how the story is told, it remains one of the most baffling cases in medical history, a reminder of how the unpredictable and the unknown can sometimes lead to fatal consequences. This case even inspired episodes in TV shows like The X-Files and Grey's Anatomy, where it became a symbol of how mysterious medical events can challenge the limits of science and logic.